Good evening, Ma'am Kalinawan. My name is Michael Angelo Mendez. I am a second-year nursing student from Broken Shore College. Today, I'll give a written demonstration on oxygen therapy. So, oxygen therapy is a treatment for patients with respiratory illnesses, and it relieves the patient of any dyspnea. It prevents hypoxia and hypoxemia. Also, it relieves any anxiety related to difficulty in breathing. So the first thing that you need to do before you perform oxygen therapy is to check for the doctor's order and also to assess the respiratory status of the client. So you can do that by carefully reviewing the chart of the patient and by using your stethoscope, which is I'm wearing right now, when you do respiratory assessment. So when we auscultate the patient, we need to make a note of the respiratory rate, the quality of the respiration, any breathing sounds or breathing pattern, and any signs of respiratory distress. So the second thing that we need to do is to choose the appropriate oxygen device. So today I'll be showing you how to install the nasal cannula and also the rebreather mask or the face mask. Okay, and we need to gather the equipment as well. So for our equipment, I'll show you guys, Ma'am Kalinawan, we have here the oxygen tank, we have the gauge, the flow meter, and the humidifier. Let's assume that that is our oxygen setup. We'll also need the nasal cannula, the rebreather face mask, a pair of surgical gloves, a gauze, and plaster. So this is not the correct tape, but we'll be using tape later on to ensure that our placement of the oxygen device is secured. And of course, I'm wearing it right now. We'll also be needing the stethoscope. Okay, so we need to identify the patient and to introduce ourselves and briefly explain the procedure. So when we do that, it gains the cooperation of the patient and also it helps to reduce any anxiety or fear from the patient's part. And we need to wash our hands using the medical hand washing technique and wear our gloves. So after we do that, we need to check the humidifier if it's filled with water and if the level is just at the appropriate. And we need to check as well if there is gas inside the gas tank by turning on the gauge. And once we turn it on and there is indeed gas in the gas tank, we need to turn it off and later on we will select or adjust it to the appropriate pressure, which is around 80 to 120 mmHg. Okay, let's assume that we've already washed our hands with medical hand washing technique. Now it's time for us to introduce ourselves to the client. So ma'am, good morning ma'am. My name is Mike. I am your student nurse today. And ang akong buhaton karon ma'am kay magtaod ko og oxygen device sa imuha para ni siya matabangan kasi imong paginhawa. Okay lang ba ma'am? Okay, thank you ma'am. Let me just check your name. Okay, thank you ma'am. Okay, so once we've done that and I'm already wearing gloves, you also need to secure the place because the oxygen tank, which is situated here, is actually prone to, it causes fire sparks. So make sure that all the significant others and watchers know that the hospital area is a non-smoking area and to watch out for anything that might cause fire sparks. Okay, so let's assume that I've already washed my hands using the medical hand washing technique and I've also done my gloves already. So now we are ready to do the procedure with the client. So if we have already checked the doctor's orders, the next thing that we are going to do is to introduce ourselves to the client. Okay ma'am, good morning ma'am. Ako si Mike, I'm student nurse. Karon ma'am, mag-apply ko og kanang oxygen therapy para makatabang ni siya sa imong paginhawa ma'am. Is it okay? Okay, thank you ma'am. I-check na ako imong armband. Thank you ma'am Lopez. Okay, again, when we explain the procedure to the client, we allay their fears and anxiety, and also it is a good way to gain the cooperation of the client. And we are now ready to auscultate the breathing patterns and the breathing sounds and the respiration. Okay, ma'am, ginawag lalong. Okay, so the next step that we are going to do is to administer or to connect the nasal cannula to the oxygen tank. Remember that we need to secure the place to make sure that safety precautions are met, and because the oxygen tank is a fire risk, so it may cause fire sparks, so you need to put no smoking signs to the room. Okay, so this is now the cannula. As you can see, it is connected to the oxygen setup, and then the prongs of the cannula should be inserted carefully to the patient's nose, just like this one. Okay, and then the two ends of the cannula, the left and the right, must be placed behind the patient's ears. Before you do that, you also need to put gauze. So say for example, this is our gauze. you put it behind the patient's ear before you insert the cannula. Okay, and basically to help put the cannula in place, you can also apply a plaster onto the patient's face, just like this one. This is optional, but you can also do that. And sometimes the end of the cannula can be placed behind the patient's scalp, or it can be behind, under the patient's chin. You need to adjust it thoroughly. You need to adjust it whichever is more comfortable or more secure for the patient. And also you need to check the flow meter to make sure that the appropriate amount of oxygen is administered to the client. Don't forget that the gauze should be placed behind the patient's ears so that skin irritation is prevented. Okay, and other things that you also need to do is to wash your hands and stay with the client as he or she adjusts with the breathing. Instruct the client to breathe through the nose and not through the mouth. And if they are now able to be left alone, if they have already adjusted with breathing through the nasal cannula, you can begin documenting. So you need to document the type of device used, the time wherein you placed the oxygen device, the amount of oxygen administered, the response of the patient, and also the breathing status or the respiratory status or the respiratory rate and characteristics. So now we will proceed with the face mask. So the steps in administering the face mask is basically the same with administering the nasal cannula. That's steps 7 to 8. The only difference is that instead of using the nasal cannula, we will be using the face mask or the rebreather mask. So again, we need to put connect the oxygen device to the oxygen setup, and then adjust accordingly. Check that the humidifier has water in it and there is gas in the gas tank, and also to check the gauge to make sure that the amount of pressure is appropriate, which is around 80 to 120 mmHg. Now for the mask, instead of a prong, the end of the mask is like this. So you need to attach it to our patient. Okay, so just like this one, the end of our wire should be connected to the face mask. Okay, and then carefully using the strap, we need to put the mask over the patient's scalp and place it inside on the patient's face. Now you have to make sure that the tightness is not too tight and it's not too loose. Basically, it's just the appropriate adjustment so that the patient will not be too suffocated. And you need to apply gauze as well. So we have here gauze at the patient's scalp. Again, this is done to prevent irritation of the client's skin. So again, while we do that, we need to stay with the patient and we need to instruct the patient to breathe normally. And when the patient is able to adjust with the oxygen device, as we adjust the flow meter and the humidifier as well to the appropriate level, we can now begin to wash our hands and document any important findings. So part of our documentation will be the response of the patient, the characteristics of the respiration, the respiratory rate. Also, we need to include the device used, which is this time is already the face mask and not the nasal cannula. The time of the administration of the oxygen device and also the amount of oxygen, administered. And we thank the patient. Ma'am, thank you kayo, ma'am. Nara ko diri, ma'am, if you have any questions or assistance, okay? And we are now done with our oxygen therapy.